Good day, everyone. I'm Brian Lee Ruggiero from BSN 2A, and today I'll be presenting about forceps delivery. It is a specialized method used to assist in vaginal birth using metal instruments known as forceps. Forceps delivery involves the use of specialized metal instruments to guide the baby's head out of the birth canal during vaginal delivery. This technique is used only when medically necessary and performed by skilled practitioners to ensure the safety of both mother and baby. There are different types of forceps, each designed for specific clinical situations. Simpson forceps are used for molded fetal heads, typically in prolonged labor. Piper forceps are designed for breech deliveries to assist the aftercoming head. Keel end forceps are used when rotation of the baby's head is needed, such as in occiput transverse or posterior positions. Wrigley forceps are shorter and used for outlet deliveries or to assist in caesarean births. Lastly, Tucker-McLean forceps provide a firmer grip and are used in certain fetal or maternal positions. Forceps delivery may be indicated in several situations. First, prolonged second stage of labor. This indicates that labor is not progressing adequately. Using forceps helps prevent maternal fatigue and fetal distress due to prolonged pressure and hypoxia. Non-reassuring fetal heart rate. When the baby shows signs of distress like bradycardia or decelerations, forceps expedite delivery to avoid potential oxygen deprivation. Maternal exhaustion. If the mother is too tired to push effectively, forceps can reduce the need for continued strenuous effort, minimizing the risk of complications. Before forceps can be used, certain prerequisites must be met. Fully dilated cervix to avoid cervical trauma from the forceps. Ruptured membranes ensures access to the fetal head and reduces infection risk. Engaged fetal head confirms that the baby is low enough in the pelvis for safe instrument use. Known fetal position prevents incorrect placement of forceps, which could harm the baby. Adequate pelvis size ensures the baby can physically pass through the birth canal. Informed consent, ethical and legal requirement to ensure the mother understands risks and benefits. Contraindications includes incomplete cervical dilation increases the risk of tearing or trauma. Fetal bleeding disorders. Forceps may cause pressure injuries that can lead to serious bleeding. High fetal station indicates the baby is too far up in the birth canal for safe forceps use. Unknown or abnormal fetal position increases the chance of incorrect instrument placement and injury. Maternal medical conditions. Conditions like cardiac disease or preeclampsia make active pushing risky. Forceps allow a safer, quicker delivery to protect maternal health. Malposition of fetal head. In cases like occiput posterior or transverse, the baby's head isn't aligned for a smooth delivery. Forceps assist in rotating the head to the correct position. Need to shorten second stage. Shortening labor can prevent worsening maternal or fetal compromise, particularly in high-risk pregnancies or emerging emergencies. The procedure begins with patient positioning, usually in lithotomy, followed by bladder emptying and administration of regional anesthesia. Once the forceps are placed carefully around the baby's head, traction is applied in sync with maternal efforts. After the head is delivered, the forceps are removed before the rest of the baby is delivered. Nurses play a critical role. Before the procedure, we must educate the mother and obtain informed consent, prepare sterile equipment, and monitor the fetal heart rate. Emotional support is also essential to reduce anxiety. During the procedure, nurses assist with instruments and provide reassurance. Afterward, we assess the newborn for trauma and the mother for signs of hemorrhage or laceration. Proper documentation of the procedure, timing, and outcomes is also a key responsibility. Like any intervention, forceps delivery carries risks. Maternal complications may include vaginal perineal tears, occur due to forceful passage of the baby with instruments. Pelvic floor trauma can affect long-term continence and function. Infection introduced by instruments or tissue damage. Postpartum hemorrhage may result from trauma or uterine atony after an instrumental delivery. Neonatal complications can include facial nerve palsy caused by pressure from the forceps on the baby's face. Skull fractures, rare but serious, especially if forceps are misapplied. Scalp abrasions or bruising due to pressure or slipping of forceps blades. Eye trauma can occur if forceps are not aligned properly. To summarize, forceps delivery is a valuable tool when used with the right indications and skilled technique. Nursing responsibilities before, during, and after the procedure ensure safety and support for both mother and baby. Most importantly, the goal is always to prioritize maternal and fetal well-being.
Alam mo